Okay, let's get started. So just let me know if you can't hear me, because then I'll project louder. So Mike asked me to do kind of a part 2 on the DNS with some more functional tests and maybe some exercises. So I picked a few that might help with just adding some more tools to your toolbox for the upper quarter. Okay. All right, so just a little review, because I think last time some of you weren't with us yet. So DNS stands for Dynamic Neuromuscular Stabilization. It's founded by Professor Kolash, who is the head of the Clinic of Rehabilitation and Manual Medicine in Prague in the Czech Republic. And he kind of pulled from a lot of different professors like Vojta and Levitt, Yanda, who I'm sure some of you have heard of, to make this strategy. And it's really based on the principles of looking at the developmental kinesiology during the first year of life, so an infant, and how it kind of connects with just the maturing postural locomotor system. So when we look at movement, we're basing it, you can kind of break it down and base it on what we would call pure movement, which would be that of an infant. Okay. So some of it, a lot of it has to do also looking at what's called the Integrated Spinal Stabilizing System, the ISSS, and intra-abdominal pressure. And you need to you need to coordinate this for efficient and purposeful movement. So you can't just, and like we're learning, and like I think more and more as we practice, we're just learning that you can't train muscles in isolation, but you need to be able to coordinate with other systems. So the goal is basically to improve or normalize the quality of postural stabilization, and also integration of respiratory patterns, and then to correct movement dysfunction or movement inefficiency. So you can use this with people who actually are hurting, or you can use it with like your athletes to just help them become more efficient. All right, and then you want to integrate or reintegrate these patterns into the central nervous system. So it's kind of bridging the gap between like ortho and neuro, where I think like has been talked about before. Just kind of the way you're moving is a reflection of what's going on in the central nervous system. So if your movement patterns are off, then you're going to display, movement dysfunction and possibly pain. Yes. Okay. And then, so just the 3 levels of motor control. There's the spinal brainstem level. So that would be, from a developmental kinesiology perspective, 0 to 6 weeks. So that's a lot of the primitive reflexes. There's not really any balance or postural function or stabilization. And then there's the subcortical level, which is kind of what a lot of this is, where we're looking. And that's when the primitive reflexes are either turned off or they're starting to be integrated into higher levels of motor control. And as they're integrated, then the babies can start to exhibit more mature postural locomotion patterns. And so this is where a lot of the core stabilization happens, and that sets the tone for muscle co-contraction and kind of supporting being able to have the joints develop, the muscles develop for walking and standing. And then there's the cortical level, and that's more like when kind of what we would call, I guess, the neuromuscular training, where it's higher level, stuff like that. Okay. So just to review, the ISSS is made up of the diaphragm and the pelvic floor and the abdomen and the paraspinals. And it also includes, the deep neck flexors as well. And so it's a feed-forward mechanism, so they turn on to establish a stable base before you start moving your extremities, whether it's your arms or your legs. And then, like we, let's see. But if you're kind of losing energy different places by inefficient stability, then it can cause bad movement patterns or injury. Alrighty. So usually we see this as overuse, repetitive strain, spinal disc stuff. So I don't know if it's clear, but there's like the picture of the chain, and I feel like people have seen this graphic before. Okay. So there are 4 reasons why the basic pattern of stabilization or breathing can be disturbed, and that can be just a congenital abnormality, abnormal early development. It could be like cultural, sport, or habitual reasons. So, for example, like gymnasts, sometimes they're uneven because they're doing a lot of twisting to one side, or it can be a protective pattern due to pathology. And so, basically, I think most of us treat, for a majority, adults or people over 1 year of age. So the strategy is to look at the movement pattern, and you're trying to find kind of the weak link in what's causing the dysfunction. And then you compare that movement to what you would see in a healthy infant. And then the treatment is the re-education by having the patients perform these developmental postures and patterns. And then also the muscles have to be trained in both stabilizing and dynamic function, which means, like, for example, if you train the glute medius, if the pelvis is fixed, what would the action be on the femur? Or open chain, sorry. What would the action? So if you're training glute med in open chain position, what would you expect it to do? What's its pull on the femur? Yeah, good. Okay. Yeah. So that, I think, is kind of what we think about. But you should also, the DNS argues you should also train eccentrically. So by having the femur fixed now and rotating the pelvis over a fixed femur to work on eccentric elongation of the abductors, which, for example, would be like for rolling. You need good stability for the pelvis to roll over the femur head without collapsing or losing, things like that. Or for turning, ballet dancing, things like that. So, okay, here's just a little picture of, all right. So, okay, so here are some of the functional tests that you could use, and we won't go over all of them, but I thought today we could go over a couple. So we're going to do the first arm lifting test, and some of these I think should be kind of reviewed because they're similar to like the MSI testing, but we're just kind of looking more also at the trunk stabilization as well. So the test position is either in hook lying or standing. So here I have a picture of the little baby. So standing would be kind of a higher level, but to be able to reach your arm up is what we're looking for. So you can either do hook lying or standing, and then you just ask the patient to raise their arms over their head. And so you're looking for isolated flexion of the arms without any chest wall movement or any movement of the thoracolumbar spine, TL junction. You're also looking for that the ribs stay fixed, so they don't like flare up because, again, that would signal poor intra-abdominal pressure and stabilization. And so you're losing energy and also having increased movement where you don't want to have increased movement. Okay, so I don't know, do you want me to go over this first and then practice, or you want to practice and then go over? Okay. Okay, so I know, like, so for MSI, you know, you as well too, if you're doing this in standing, you would look at scapular mobility and things like that. But I like using this test in supine because it kind of shows me what they're doing, where they're moving other places, and you can control them a lot better in hook lying. And then the treatment would be kind of your normal treatment. You can release, you know, soft tissue to release fascia. You mobilize the lower ribs. And then also, too, you have to correct the faulty respiration pattern. So this is where looking at breathing really comes into play. Are they breathing using their upper chest? Are they able to breathe into their lower abdominals and keep the rib cage in the neutral position instead of inspiratory position? And kind of seeing if, and then you can then look at tissue tightness or stiffness, I'm sorry. Okay. So then we have the trunk extension test. Let's see. So this would be, if you look at the baby in airplane, it's like 5 to 6 months, they kind of start doing this airplane thing. So there's 3 different test options for this. You can do prone with arms just along your side. You can do prone with hands clasped behind your neck, or you can do prone in a push-up position, which would be like the infant prone 3 months, when they're 3 months, and they're kind of pushing up. And so and then you just ask the patient, okay, lift your head off the table and see what they do. And so this test is looking at whether they're able to coordinate trunk stability, and also seeing kind of what the scapula is doing, what their spine is doing at the C-spine and T-spine as well. And you're also looking for where they're starting their movement. So are they starting it in the upper cervical, or do they have movement in their thoracic spine, or are they really using like their lumbar spine to move? Okay, so here would be an example. What we're looking for, if you look at the bottom baby, is, well, let me show you a not ideal. So here would be someone who's having a little trouble, okay? So, yeah, if we look at, like, so where do you feel like a lot of their movement is coming from? Yeah, so lumbar spine. They're not really, their shoulder blades are elevated, so that's how they're stabilizing there. They're using like a lot of also like hamstring and glute to help them. And if you look at their stomach, like their abdomen, it's kind of squishy looking. There's nothing's really activated. So if we compare that to like our baby and even the woman it's a balance between the stomach muscles and the back muscles. And then really what you're looking for is kind of the T4 is, it's like the transition segment. So that's where you should be lifting from. And then the glutes shouldn't be turned on so much. Okay. And like the baby kind of looks like it's hanging out there. It shouldn't be so effortful. I mean, it's hard to do as an adult, but yeah. Okay. And then also some other ways people might overcompensate is if they're really lifting up their head, or if they're really rigid in the chest you might see, like this guy, some movement in the lumbar, more movement in the lumbar spine. So the test is kind of the treatment position, what I would do. And this test I would use, or this exercise I use for people, you can use it for a lot of different things. You can use it to help stabilize working on higher level core activation. You can use it if you find that they just have weak serratus and they're not stabilizing with their shoulders well. You can use it just to work on kind of elongating the spine. So what you would do is, not usually, but if they're really stuck, you can. Yeah, you can. Yeah, you don't, normally I try not to have a pillow underneath, but if they're really stiff. Yes. Yeah. You can also, they have the ball, like for some of the older patients, if it's too much, you can have them on the stability ball to give them a little bit more flexion at the hips. Yeah. So what you do is you have your patient lie prone, and so the weight-bearing points are going to be on your medial condyles, and you want kind of flat hands, so not ulnar side or radial side. Okay, and then the ASIS and the pubic symphysis. So those are your points of contact. And then at 3 months, the babies are able to have their shoulder flexion is like 90 degrees to their body at this point. So she's a little bit more than 90, but you can kind of play around with what's comfortable for the patient. And then you're going to have them kind of push away from the table to get the shoulder blades to kind of come into a nice neutral position. And so again, what you're doing here is you're training the serratus from or where the humerus is now fixed, and so now it has to pull and stabilize that way. Okay, and then you're just going to cue them raise up from T4 and try to maintain that position. So it's kind of I do 1, 2, 3. So 1, you have to engage the abdominals. 2, you push away, and then 3, you can lift and see if they can hold it for a couple seconds. What you're looking for in this position, common mistakes are like they're either really extended in their C-spine, or their shoulders start to elevate or protract. They have a lot of kyphosis or lordosis, or they're squeezing like buttocks, hamstrings to get the stability. It'll make more sense, I think, when you guys practice. Yeah. Okay. And then the last one, if we have time, is the quadruped rock. So I know you guys are familiar with the quadruped rock backwards to look at kind of hip and lumbar spine. This one, you're going to rock forwards. So this is based on like 7, 8 months quadruped, where baby's kind of learning how to rock back and forth before crawling or before creeping. Sorry. This position is really nice because it's working again on scapular stability, nice elongation, and then if you look, both the baby and the model here have nice straight lumbar spine as well, lumbar and T-spine, and it's just kind of, we call it elongated spine, so they are able to maintain that position. So you have the patient rock forward slightly and hold the position for 5 seconds, and then you're going to look at what their scapula is doing. So is it internally rotating? Is it externally rotating? Are the upper traps kicking on? Are they able to maintain a good lumbar spine position? Also interesting, so important setup for this one, palms need to be flat. So no, people tend to do this or grip, or again, it needs to be kind of flat hands, not on the ulnar side of your hands. And then you'll see, like, if you do this with infants, if their reflexes, their palmar grasp, if it doesn't go away, they have trouble like opening up their hands. So this is also helps integrate that as well. Okay.
What about your arthritic patients who are painful, tendon with the fist, or?
So you could do So for the people who can't have wrist problem, the carpal tunnel, I'll do it on, again, a stability ball, so they can kind of do that. Or you can do modified, so that their hands are a little bit over the edge of a table like this. They can still pull themselves forward. It's just, not as much pressure goes through their hands. Also, for this, another modification would also be to have this test position on a wall. So they would do this on the wall and push if getting into prone is too difficult. So you'll have them rock forward. You can do side to side too, to check for symmetry between the scapula. Okay, so those are the 3 tests we'll go over. We'll start with, so I guess pair up. Okay, pair up in groups, and then we can go through the test. So then you can kind of look at, possibly pull other things. So it could be lat tightness, could be cervical.
The DNS which goes into your stability, right? So.
And then the other thing would probably be because as he goes down, his head comes up.
Like the whole column.
Yes.
The whole, what do you call that?
So I would even. So maintain the chin tuck and lift.
No. Better though. You can't flex as much.
So sometimes I'll just. Okay, go ahead. Sorry.
You got a defective one, Allie.
No. So then you can kind of use, everyone has their own tools. It's just another way to look at it. Because now you're seeing, okay, if I tack this down, his range is less. So you can practice this at home, or you can also kind of do like the wall slide, except being able to hold this while you go up, to get a nice strap. You could do, same thing, Thanks, Felipe. I mean, the other thing you could look at too is like if you palpate under the diaphragm, if there's like, kind of trigger points there. So check the fascia and things like that. A lot of it is like rib stiffness too. I found, especially for, I don't know, like, if they kind of, So you can, and that's where you would just.
What?
He was thinking because my toes are off.
That he's more predisposed to already pulling him forward. I mean, I'm not saying it's going to be a major factor, but if that changes how easy or how difficult that would.
Yeah, I mean, keeping it down,
Because then his lower abdominals don't have to work as hard.
So what you're going to do, I'm just going to move your arms up a little bit because we don't have enough space. So we'll look over here. Now, can you breathe into down here, friend? So already when she breathes in, it's like this way. So when you inhale, try to like push my fingers away. There you go. Good. And again. So kind of, yes, keep that pattern there.
I never breathe like that.
Wait, you lost it.
Again?
Wait, again.
Didn't do it that time.
No. Perfect. Good. So I want you to keep breathing like that, and then kind of do like a Kegel squeeze so you activate the pelvic floor, which is a backdoor way to turning on the abdominals.
Oh, there's so many things.
Yeah. Just because you want that activation here. Yeah. So this would be number 1. Good. So maintain this position. So it's a lot of abdominals here. And then next, like right through here, you're gonna kind of push like down and away. So you're gonna kind of push down. Oh wait, don't lift yet. Just push down so that you feel your shoulder blades kind of coming down in this position. There you go. And right now, if I press, it's still relatively like, it's kind of soft. Yeah, yeah. So you kind of go ahead and push away. A little less. Yeah. So again, push. So it's coming down this way. Good. So this is one. So maintain this position. So activate here. 1, push away with your elbows. 2, down this way. And then lift from here. So keep your chin tucked and lift. Good. And breathe and hold. Yeah. There. No. Yeah. Can you feel these muscles working?
I think everything's working.
Yeah. Okay. Good. And then rest. Yeah. So it's like 5 seconds. Yeah. It's a lot of work.
One and with the
Quadruped rock. Yeah. But I think it's good just to, it helps
Oh, so
people
I have my
feel
homework
what their shoulder blades feel like too.
Oh.
And to be able to lift like up rather than like this or like
So this
like
is
that.
all to assess.
Both treatment and assess. Because you're kind of looking at their movement pattern just.
So I would need to work it with diaphragm
Yes.
breathing,
And
that would be
here.
more. And I need to work on.
That, I mean, if you were
Spinal.
having like shoulder problems or something, yeah. Or back problems, you can work on it. Yeah. Sorry.
It's
Yeah.
good to see it in action though, huh? Okay. But half the time we don't know, what muscle is that? No.
Yeah. Well, I think breathing is like a big thing.
I find that a lot of patients really don't have a clue. I mean, like,
Yeah, I feel, and then like the breathing is a big thing because if you're breathing like chest breathing, you're never really giving yourself like a stable base to work off of when you move your hands or your arms or neck, because technically the deep neck flexors attach at T4. That's why they end in the front too. So it's part of the system here. Yeah. Yeah.
Can you do that one more time so that I can feel?
Yeah.
Yeah, I can feel you. You would need to cue yourself because I wouldn't know.
my arms were right here, is that right?
So really, actually, what you should have her do first
Just to relax.
is just have her do it, like lift up and see what she does.
Oh,
With my neck?
Just kind of push yourself up and let's see. I mean, it doesn't work as much because she knows what to do, but see how there's
we
like,
were seeing.
yeah,
I saw
so
that right away.
there's this here and then her shoulders kind of come up a little bit. Yeah. So then you can correct.
So go ahead and I think you needed. Okay, there you. Is that the way?
Yeah, so you can,
So I can see already that she lifted more from here and that she was going.
yeah, and then you can always check, like, if you put your hands here and ask her to breathe. Yeah, see how she's breathing. So you put your hands here.
Can't hold my breath.
No, just keep breathing so that Tony can feel how you're breathing.
There you go.
Chill.
Just breathe. Yeah. So you're checking to see if, like, when they take a breath in, if they're, like, not breathing correctly.
And then for her, you said to engage her abdominal.
Yeah.
Trying to go.
Yeah, it's just kind of, I physically help,
Are
but
you engaging it right now, right there in the front?
I forgot about my breathing.
yeah, breathe. Yes.
Alright, and then now the next one is to try to go. No, don't lift up.
Yes.
To just move. Yeah. And do that again.
Like several sequential steps.
Maintain this here. Maintain this here too. See how you walk?
I do.
Maintain.
Normal. Yes.
And then go.
Correct. Unlock your elbows just a little bit. Okay. So it doesn't. Good. Okay. So I'm gonna just push her. Can you come up here? Push up just a little bit. Come up, come up, come up. Hold that. Okay. Yeah, it's getting tired. Even holding that. Yeah. So that would be my exercise for you to start with. Yeah. Okay, rock back. Relax. But can you feel the tension?
Yeah, I can.
Yeah. So So if we were to do the quadruped rock forward, I'm going to have you scoot back so your feet are kind of off. So I just have her get into a position first, however she wants to. And so what I look at is lumbar spine, thoracic spine, her head position. I'm also going to look at what her hands are doing. Like elbows, is she nice and soft or hyperextended? And then kind of taking a look down here too. And so you want them in a nice little square. Okay, so I'm just going to have you rock forwards. So come forwards, stop, hold it, 2, 3, 4, 5. So we're looking at what it's doing at the shoulder blades, and then come on back. Okay. So then that didn't look great to me. More so, like the scapula doesn't have to be like directly always glued to the spine, but it is coming away a little bit. And if I feel here, she has a lot of tension in her neck. So what I'll have you do is first open up your hands. So I want her weight bearing to be kind of like through the index finger and thumb, so kind of pushing through here and here, and then relax your elbows. And then I'll manually kind of take her shoulder blades down and back a little bit, so they're a little bit more centrated in the joint. Okay. Let me fix your head. So her head needs to come up. And then when her head comes up, then this happens. So yeah, good. So I want you to keep breathing into my fingers here. Can you breathe? Take a breath in and push my hands. Yeah, perfect. So keep a nice activated stomach. So this might be kind of her position of treatment. And then sometimes I'll just cue by putting my hand like on the sternum and just, whoop. Yeah, just raising up just a bit through here, like right through T4, up, up, up. Good. So this is why like quadruped would build on prone 3 month. If they can't do 3 month, then this is going to be a little bit more challenging. Okay, so I'm just going to have you push into, rock forward and just push into my fingers. Good. Hold it. Good. Hold it there. Hold it. 2, 3, 5. And then come on back. Okay. Relax. Yeah. So yeah. So it's a little, I mean, she's able to maintain a little bit more, but it's a lot of work. So these exercises, if you give them to someone, one, take pictures, but don't give it to them for homework if they can't reproduce it on their own yet. And then really when you're doing it at home, you only need to do like 3 to 5 reps, because if you're doing it correctly, you're going to fatigue easily. Yeah. No. I usually take pictures of the patient for them. Yeah. I guess our next student could do pictures. Yeah. Could you feel your muscles working? Yeah. It is. Oh, okay. Sometimes these tables too are a little bit too squishy, so using the mats on the floor is actually nice as well. And then everyone's a little bit different, so different corrections work for different people. So sometimes even if they're really hyperextended, if you just unlock their elbows, it'll fix like the scapular position. But some people it doesn't. So it kind of depends. You have to play around with it a little bit. So the goal is really to get a nice neutral spinal column, throughout.